Thank you, Mr. President, members of the Senate. I bring to you House Bill 1013. 3 years ago, we formally acknowledged the fact that Georgia is facing a mental health and addictive disease crisis. We, the General Assembly, under the leadership of Governor Kemp, decided to put experts together, and we formed the Behavioral Health Reform and Innovation Commission in 2019 for the purpose of conducting a comprehensive review of the behavioral health system in Georgia. We knew our problems were not unique, but we decided we wanted to find Georgia solutions instead of waiting on other states or the federal government to figure out how to address this issue. These experts were led by former House member, Chairman of the Commission, Kevin Tanner. It included medical providers and specialists, education officials, members from law enforcement, members of the House and Senate, judges, behavioral health advocates, commissioners from departments across the state, and others that work on the ground directly every single day dealing with the effects of mental health and addictive disease in our state. And while facing the challenges of COVID-19, these experts got to work, and they delivered recommendations to us as to where we need to start in our state to change the way we address mental health. And I want to personally take a second to commend the Speaker of the House, David Ralston, and our colleagues in the House, including Chairman Todd Jones and Chairwoman Mary Margaret Oliver. They showed the courage to take a stand on this issue when they filed House Bill 1013, a bill that included many of the recommendations from this commission. While the House worked on the initial draft of House Bill 1013, senators in this body, such as Senator from the 1st, the 11th, and the 32nd, began to work on other solutions to help the senator, and also help me and the senator from the 41st as we started a joint mental health caucus, starting to talk about what House Bill 1013 was all about well before the bill even came to the Senate. And when House Bill 1013 passed, a big group of us senators stood with advocates on the steps downstairs, advocates from around the state that are committed to working with them to make sure that House Bill 1013 was still the best possible bill it could be when it came out of the Senate. And I want to recognize some of the members of the Citizens Coalition that are up here in the gallery with us watching. We have Jeff Breedlove from the Georgia Council on Substance Abuse, Kim Jones with NAMI, Abdul Henderson of Mental Health America. These advocates helped us make sure we got this bill right. The chairman from the 1st and the 11th conducted, I believe, 5 hearings on this bill, heard from people from around the state in person, in writing, on the phone, and even on the weekends at the grocery store and at church. The Lieutenant Governor's Office and our leadership of Regina Quick and Macy McFall, along with our legislative council, helped us get to the floor of the Senate with what I'm convinced will be a bill that will soon be sitting on Governor Kemp's desk. Through this process, we have shown everybody that the legislative process works. The House worked with us to make the bill better, to address potential unintended consequences that many expressed to all of us. But together with House Bill 1013, we have brought a bill that every single person that we heard from on this issue can be proud of. Now, the bill has many, many parts. I'll briefly go over the parts of the bill and then take questions. With part 1, what many people said is the meat of the whole bill, we address our federal parity law, making sure that we're enforcing our parity law here in Georgia. We also have provisions to make sure we're getting the data we need through our Department of Insurance to make sure that this law is being enforced across our state. We also codify that our most vulnerable under Medicaid and Peach Care for Kids programs are receiving the coverage for mental health and substance use disorders that they should be receiving under federal law. Under Part 2, we acknowledge the fact that we can have all the coverage in the world for mental health in our state. But if we don't have the workforce where this service is being offered in every corner of our state, we're still not accomplishing anything. So with Part 2, we have targeted cancellation loan programs to make sure that we're getting the providers we need in every corner of our state. We also charge the Georgia Board of Health Care workforce with creating and maintaining the behavioral health and care workforce database to collect and analyze minimum data set surveys for behavioral health care professionals. In Part 3, we address involuntary commitment. We codified the assistant outpatient treatment program we currently have going in our state and set up a grant process to keep this going through DBHDD. Bringing community service boards or private providers together with community partners to help assist those that qualify for involuntary outpatient care. We also updated the definition of outpatient when considering an individual with mental illness and for a person that's an alcoholic, drug dependent, or drug abuser. On the Senate side, we tightened up the House version when it comes to the ability to admit individual believed to be suffering from mental illness or to be an alcoholic, drug dependent, or drug abuser, by leaving our current law intact when it comes to the ability of an officer to detain someone that's committing a crime while suffering from one of these conditions, and simply provide an alternative means where an officer, after receiving authorization from a physician, may take individual to emergency receiving facility to be evaluated without having to charge that person with a crime. In Part 4, we addressed our accountability courts. We require our Criminal Justice Coordinating Council to establish a grant program to help fund accountability courts that serve the mental health and co-occurring substance use disorder population. We also included a House Bill 570 that was filed by Representative Neal, which provides training for peace officers at Georgia Public Safety Training Center for behavioral health co-responding, and we included funding for grants for co-responder programs. Part 5 of the bill, we addressed child and adolescent behavioral health. We required the DBHDD to annually report the complaints they're receiving to the Office of Health Strategy and Coordination. We also established a multi-agency treatment for children team, where multiple agencies will come together and collaborate on meeting unmet needs for children in our state. And finally, in Part 6 of the bill, we addressed Behavioral Health Reform and Innovation Commission that I started with talking about. We added additional studying and reporting from the Department of Community Health to this commission, which will include the reimbursement rates for mental health services under Medicaid, Peach Care for kids, and the state health benefit plan with other states, and how our uninsured are being cared for in our emergency rooms. We also added additional duties to the Behavioral Health Reform and Innovation Commission while extending the sunset for its termination for additional 2 years. And finally, in this section, we require Medicaid coverage for certain prescribed treatments to address mood disorders. Members of the Senate, along the journey from what was known as House Bill 514 in 2019 that started the Georgia Mental Health Reform and Innovation Commission. And throughout this session, as we worked on House Bill 1013 and other issues in this body, we heard many stories from people that moved us. We heard from strangers that were willing to stand before us and share their personal stories about how mental health and addictive disease had changed their lives and the lives of their family members. And we commend you for stepping out to allow your situation to be used to prevent more folks from going through what you had to face. But members of the Senate, I think I could say along with all 10.7 million Georgians, we all unfortunately have a story. For some, mental health and substance abuse hit us closer than others, but we all have a story that we could share. And today I ask you to think about those living, breathing examples of this crisis in our state. As you join me in doing something that isn't very common these days, set aside our political and regional diversity and send a strong message to our constituents around the state. Georgia is taking on mental health reform. And in closing, I'll acknowledge that House Bill 1013 doesn't solve our mental health crisis. Many parts of this bill are long-term investments that will require much more work in the years to come. But together, with the passage of House Bill 1013, we'll start the process of making Georgia not only the best state in the country for business, but the best state in the country for mental health services. And with that, Mr. President, I'll be happy to take any questions.
You don't appear to have any questions.
I ask for your support for House Bill 1013. Thank you.
Chair